Hi everyone, this is my immigrant interview with Dr. Fabiana Heilman. This is for DEH 355, and my name is Rebecca Way. This is Dr. Fabiana Heilman, also known as Fabi. She was born and raised in Sao Paulo, Brazil. She moved to the United States in 2008. She actually practiced as a dentist in Brazil from 2002 to 2008. In Brazil, they have different standards for dentists, and she actually started practicing dentistry at the age of 21. When she did move to the US, though, since they do have different requirements for dentists, she had to go back to school for 2 more years, where she received her degree at UCLA in California. She has lived in several states in the US. Colorado is by far her favorite. She's lived in California, Wisconsin, and Tennessee. I just wanted to add in these two photos of Fabi and I together. She is extremely active, as you can see. What is the primary language of Brazil? That would be Portuguese, and it's the primary language that she uses to speak to her family in Brazil. When she is here talking to friends in the US, she only uses English, and she was taught English at a very young age and is very fluent with it. Actually, in Brazil, 97.9% speak Portuguese, 1.9% speak German, and 1.9% speak indigenous languages. So you can see that majority of the population does speak Portuguese. The picture on the left is a photo of Fabi and her mom. She is the only person living in her family in the US. Both her mom and sisters reside in Brazil. She does normally travel to Brazil every year for Thanksgiving to spend time with them. Since Thanksgiving is a US holiday, she is able to go to Brazil a little less expensive than the rest of the year. She does take a yearly trip with her mom, and they love to travel together, and her mom normally comes to visit once a year. And sometimes Dr. Heilman is actually the one that provides some dental care for her while she's here. Some things to know is that Brazilians are incredibly family-oriented, and this is why she enjoys spending time with them so much. She also does provide financial assistance for them. So she does identify herself as primarily Latina, although most of the US doesn't consider Brazil to be a Latina country because they don't speak Spanish. But she also believes in the Japanese culture because she is half Japanese. One of the most essential things that she wanted people to know about the Brazilian culture is they are extremely touchy-feely. They're a very expressive culture. They like hugging and kissing and handshaking. In our book, the cultural book, it does state that Brazilians greet everyone with a hug, and so if you're a family, friend, or acquaintance, you normally would receive a kiss on the cheek, and if it's a family member, you'd receive a kiss on the lips. In typical business situations, though, women will typically hug and men will normally shake hands, although handshakes can be appropriate in some formal settings. Her view on illness includes making her own medical decision. She does not rely on family for medical advice. She is rarely ill, as she does live a healthier lifestyle. If she did need the help from someone, she would call a friend. Being sick to her means being unable to perform normal daily tasks. And since she does follow a traditional Western medicine model for health, she normally just relies on her physician's recommendations for whatever treatment is needed. One of the biggest issues she may have for seeking medical treatment is just time. And the reason it comes to that is due to being a dentist, she would have to cancel her patients or reschedule them, and her schedule really goes pretty much the same as a normal physician's schedule does. These are just a few photos to show how active Fabi is and kind of how her wellness beliefs align with a healthy, active lifestyle. Fabi's wellness beliefs come from a very active lifestyle. She loves being as active as possible. That includes hiking 14ers, skiing, snowshoeing, rock climbing, yoga, lifting weights at the gym. She was a yoga instructor when she lived in California when she was going to school. She does limit her consumption of alcohol, and she provides her body with a very nutrient-dense diet. And she fully believes in preventative medicine and going for yearly exams. Fabi's medical views come from a very traditional Western medicine belief, similar to us in the U.S. She does know that there is a small portion of Brazilians that believe in a more alternative medicine path, similar to folk healers. Since Brazilians do have a strong traditional relationship religions and spiritual healings, they do have Catholic priests that perform sacrament for the sick, similar to how they do in the U.S. But they have the folk healers that give blessings and prayers and also utilize herbal remedies, such as drinking herbal teas and medicinal teas, normally used for gastric symptoms. And although many Brazilians are religious, Fabi is not. She's actually agnostic. The biggest social determinant I was able to find would be a possible language barrier, since most Brazilians do speak Portuguese, and it could be very difficult in the U.S. to find a fluent Portuguese interpreter. This could result in patients not seeking oral health as a preventative measure, or even going to see a physician just out of fear of discrimination or not being able to be fully understood without a proper interpreter. Her biggest advice for healthcare professionals is just going over co-payments with the Brazilian patient, because although they have private healthcare insurance, they don't have co-payments like we do here in the U.S. In the book, it does mention that Brazilians will seek medical care, but it's traditionally for illnesses that are already pre-existing and not to prevent diseases. And then if you're recommending treatment, they may be more open to listening to a doctor rather than a nurse. So my biggest takeaways from this interview is that Brazilians are incredibly touchy-feely compared to us Americans, and they really appreciate handshakes and hugs or kisses if you are a very close family friend. So they would take that more as a sign of disrespect if you didn't shake their hand, although that's not possible during COVID times right now. Another thing is just making sure you're really going over co-payments with them, because if you don't, there may be some confusion since they are not used to that like we are here in America, even though they do have that private health care insurance. And the final thing is just making sure if a patient is from Brazil and they only speak Portuguese, that you are able to have an interpreter for them so there is no confusion on the recommended treatment. And that way they actually feel respected in the setting and not discriminated against.